Good morning, everybody. My name is Fabian Levy, and I serve as Deputy Mayor for Communications for the City of New York. Thank you all for joining us today for our virtual employee town hall. This town hall is an opportunity for our health and human services workers to hear directly from Mayor Adams and Deputy Mayor Ann Williams Isom, and for both of them to hear directly from our health and human service workers. While our administration communicates with people every single day through our public events, interviews, town halls across the 5 boroughs, social media channels, and more, these town halls have the specific aim of talking to our public servants. After holding one of these town halls for all our city employees earlier this year, we wanted to hold one specifically for our health and human services workers to hear about the issues that are top of mind to you. We were thrilled by the responses we received and the hundreds of questions you sent in from Mayor Adams and Deputy Mayor Williams Isom. You asked about public safety and affordability, social services and education, housing, healthcare, and more. While we won't be able to answer all of the 215 questions that you submitted, we worked to choose questions that represented the top issues we heard about and cover a wide range of topics. For today's town hall, we are joined by a group of public servants who will be asking their questions out loud. We also have questions that were submitted anonymously, and I'll be reading those. But before we get to the questions today, I'd like to turn it over to Deputy Mayor Ann Williams Isom. Deputy Mayor?
Thank you. Thank you so much, everyone, and good morning. I'm Deputy Mayor Ann Williams Isom, the proud Deputy Mayor for Health and Human Services, and I'm really glad that the mayor decided to start with the best employees in New York City, our portfolio. Whether or not you are connecting people to food and cash assistance, whether or not you are working to end domestic violence, whether or not it's serving veterans or older adults, our homeless population, our Department of Health, ACS, the Medical Examiner's Office, or Immigrant Affairs, the work you do is essential here in New York City. The Health and Human Services portfolio has over 68,000 people in it and $2 billion in annual spending. And you do all that to help New Yorkers thrive from ages 0 to the end of their lives. And so here, we are so thankful to be here and to listen to the questions that you all have submitted, and we look forward to answering them. With that, I'll turn it over to Mayor Adams.
Thanks so much, DM. DM Williams Isom is probably the deputy mayor that I quote the most when I'm at public events because of her portfolio and what it covers. And it is a portfolio that impacted my life a lot as a child, and Mom was in need of the services that were provided, raising the 6 of us primarily on her own. My siblings and I depended on the services that we're talking about and the services that many of you provide. So we cannot say thank you enough. And the primary reason these town halls are important to me is because when I sat down with Jordan a few months ago and started talking about some of the things that we have been doing in this city, he was like, Dad, I didn't know that. Because we are inundated in the city, in the country, with everything that's negative. People don't highlight the great work that we are doing, not only as a city, but our entire nation. Civil servants, public servant workers all over this country are doing amazing things in general, but specifically when you look at the most important city, and that's the city of New York. And so if Jordan didn't know what we were doing, then we're saying our employees may not be aware. And we found out that after having informal conversation with our employees, many of you were producing great results and did not know what you were producing and how well you were doing in the city. Think about you and your colleagues. January 1st, 2022, we inherited COVID. And many of you were dealing with the impact of COVID, not only in your professional capacity, but even at home, your family members and loved ones. I am sure everyone out there must have lost someone due to COVID, and it was traumatizing, but you got up every day and still provided the services. And then as we cycled out of COVID, we had to deal with 220,000 migrants and asylum seekers. Some of the same people that dealt with COVID had to deal with ensuring that we treated those migrants and asylum seekers with dignity and respect as we dealt with the over 60,000 people who were already in our homeless services. So what did we do? We rolled up our sleeves. We do what we do best. We responded, and that is what the results show. And you need to know about the success you have done as professionals in the city. We removed and assisted over 8,000 people in need off our subways and into shelters since the start of our administration. 8,000. We placed nearly 17,000 people into permanent housing in the last fiscal year, helped over 12,000 families access doulas and midwifery services through our new family home visits initiative. We opened 7 lifestyle medicine clinics so that we can look at the predeterminants of health so that you don't spend your entire life on medicine, but how do you improve your lifestyle? And we launched innovative programs. One of them that I'm really proud of under Dr. Fassan is Teen Space. We allowed our young people to use technology to get around-the-clock support for mental health issues in our schools and in their private lives. Extremely impressive. And early this year, we held a virtual town hall for our city employees, and we wanted to make sure that the health and human services workers have a chance to hear directly from me, hear directly from the deputy mayor and the deputy mayor of communications, so we could communicate with you and learn from you. These interactions and exchanges are extremely helpful to us, that we can know what we can do on the ground, inform you, but at the same time, you need to know that this city has turned around under the actions that you carried out every day. And I say thank you. Earlier today, we were speaking to someone, and they said, listen, I'm going to call you Eric because of the feeling of personal interaction. And that's who I am. Yes, I have the title of mayor, but I'm on the subways. I grew up in South Jamaica, Queens. I went to public school. I went to public college. I am you. I represent what you stand for, and my family represent what you stand for. So we look forward to this dialogue and look forward to communicating with you as we learn more and as you learn more of the success that you have brought the city of New York. Thank you for the work that you do.
Thank you very much, Mayor. And I'll just echo your thanks to all our city workers for all they've done for the last 2.5 years. So we're going to start with a question submitted anonymously and address an issue we know a lot of city employees have thought about over the last 2 months. It is, given the number of high-profile resignations in your administration and turnover at the highest levels of our government, how do you expect city employees to maintain confidence in our leaders and yourself?
Well, I think, and we hear that often, and there's always movement in administrations. And I think that after the investigation happened, there was just a focus on every movement that took place. But we still have our commissioners in place, Department of Parks with Sue Donahue, Zach Iskel over at OEM, and I could go down the list. All of our deputy mayors are still, and our top deputy mayors are still with us, from Deputy Mayor Williams Isom, Deputy Mayor Levy, First Deputy Mayor Maria Torres Springer, Deputy Mayor Mira Joshi, Deputy Mayor Anna Amazar. When you look at the team is intact. But most importantly, all of us know that in our lives, we have challenges. The question becomes, how do we face those challenges? I face them by my deep faith in God, but also my commitment to this city that I love. And the numbers show that we're continuing to improve. 10 straight months of decreasing crime in the city. Our subway system, so you know, is the lowest crime in over 14 years if you remove the COVID numbers. And robberies on our subway system are the lowest in recorded history. In August is normally the month where you see shootings take place. We're at the lowest number of shootings in the month of August in recorded history. We're still producing the jobs. We're still rolling out these major projects. More small businesses have opened in this city, in the city's history. And so in spite of all the challenges that every New Yorker goes through, we continue to move forward. And it's because of people like you. We're resilient. This city leads the way. Remember 9/11 when our center of trade was collapsed? What happened 9/12? We got up and we did our jobs. Just like many of you, as you deal with personal traumas in your lives, you still get up, you still move forward, and you still inspire your family. And that's what we're going to do here in this administration. And it's not this administration, it's our administration, because you're a part of this administration and what we're doing.
And can I just add, because, you know, the deputy mayors and I get this question all the time. And the first thing that we always say, because many of us have dedicated our life to public service, when I graduated from college, I actually went to work for the community-based services in the NYPD for 2 years before law school.
I didn't know that.
I know, I was hiding it. And then when I, after that law school, I went back to ACS for 13 years. Public service and being a public servant is so important. And so for us deputy mayors, the 300,000 people that work for the city, you're the reason that we are stable. You're the reason that we're able to stay focused. We know that we are here to make sure that you have what you need, and that the reason you took these jobs were not for drama, but so that you could serve New Yorkers. And so we want to be there in order to do that. And I think that's what's been happening at City Hall.
Yeah, well said.
Very well said, Deputy Mayor. That's why she's my favorite Deputy Mayor. I can say that. He can't say that. All right. Our next question is, it was going to be from Chris from the Department of Homeless Services. He unfortunately couldn't join us this morning, so I'll read his question. His question is, what is being done to ensure that your essential working staff can continue to afford to live in the city?
You know, one of the greatest philosophers I heard said, the rent is too damn high. You know, it is difficult to live in this city because of the affordability issue. And, you know, you can't get away from that. Inflation, the cost of living in the city is unbelievable. The other day I was speaking with Tracy, and she was telling me, I thought somebody was talking about butter being $7, and it was $9. It's like, wow. So we know it's hard. And so what we said is, what can we do? You know, we don't have the power to make bread cheaper. We don't have the power to bring down the cost of items. But what can we do? We started an initiative called Money in Your Pocket. Over $30 billion. We found ways to put money back into the pockets of everyday New Yorkers. We started with your salaries. We settled 97% of union contracts, and they were getting 97, 98% ratification from you as the members. We went in and said, how can we give fair contracts? We negotiated with DC 37 and the other unions to make sure UFT, NYPD, all of these different unions to say, let me give you a fair contract, because as a former civil servant, not only as a clerk in the DA's office, but also as a police officer, I knew that contracts must be fair to workers. That's what we did. Then we went in and said, how do we find other places? Earned income tax credit. Increase the amount of earned income tax credit with our Albany partners. Those of you who live in NYCHA development, we gave free high-speed broadband for NYCHA residents so children could get access to remote learning and parents get access to telemedicine. Then we went in and looked at our foster care children that many of you look at. And I was really pleased when I heard their college enrollment when Deputy Mayor Williams Isom shared it. We're paying college tuition, giving them a life coach until they're 21, and making sure they get a stipend so they don't slip through the cracks in the process. But we've also went out and conducted what we call hiring halls to get people employed in a very real way. And we are paying off medical debt. This is hundreds of millions of dollars. The number one cause of bankruptcy in this city is medical debt. And we're paying off medical debt for eligible New Yorkers so that we can ensure that they don't have to file for bankruptcy in the process. building more affordable housing so that it could be affordable, so you can actually live. 50% of New Yorkers are paying 30% more in their rent. So we want to zero in on affordable housing, and we did just that. We financed more affordable housing in year one, year two, in those particular years in the history of the city. So we know it is expensive to live in the city. Everything from reduced fare Metro cards to making sure that we give you counseling in our small business services for those who want to start their little small businesses at home in addition to working for the city. Our goal is to say what is within our span of control to address the affordability issue in the city, and that's what we've been zeroing in on. And if you have some ideas, please share it with us. We want to find more ways of putting money back into your pocket.
And the only thing I think I'll add, as Mayor, you talk about this all the time. I have a 94-year-old mom that lives with me, so we know that seniors really, the affordability and making sure that they have the housing that they need. I have young adult children in their 30s and 29s who want to be able to have and to be able to be in this city, and we have to have young adults in this city, so it has to be safe. And so those things are connected to affordability. Yes. And I think about, I'm not a grandmother yet, but hopefully my children are watching this, and I will be a grandmother one day. While childcare is very important and having good schools, all of that, you need to have an infrastructure and a city that works so that people can stay here and want to be here. And that's what the mayor has really been focused on from day one.
And I think that's crucial what you said about even childcare. Do you know when we came in office, childcare was $55 a week. That's $220 a month. We dropped the childcare cost down to less than $5 a week. In year one of our administration, partnering with Albany. And what the DM said is so important. And what's unique about, what I like about this administration is that we don't deify ourselves. We're normal, everyday people. Right. You know, the concerns that I have about Jordan are the same concerns that the deputy mayor has about her children, right. Her mother who's staying with her. That's These right. we have the same issues. We sit around that same kitchen table that you sit around and say, you know, hey Jordan, when you gonna give me some grandchildren? You know, we are you, and we bring that energy to the work that we're doing.
Deputy Mayor Williams-Isom, you said you weren't going to put pressure on your kids.
I know, sorry. No pressure, no pressure.
Mayor, I would just like to clarify. So you said there was hundreds of millions of dollars in medical debt. It's actually $2 billion in medical debt that we're forgiving.
Right, that's right.
And for New Yorkers, if you go to nyc.gov/money in your pocket, you can learn more about exactly what the mayor was just talking about. So next, we're going to go to Andre at the Human Resources Administration with a question about the future of social services.
Good morning, New York City. Good morning, Mr. Mayor.
Good morning,
colleagues. I have a question in regards to, I'll get to the point. Given the increase of complexity on social services, the needs and the evolving landscape of public assistance programs, how do you envision the future of the HRA system? What innovative strategies or partnerships can we explore to ensure that the system remains relevant, effective, and responsive to the needs of the community? Thank you, Mr. Mayor.
So I know you addressed it to Andre, to the mayor, but let me start and then the mayor can add. And I'll start by saying when you think about technology, it's another thing that he really has asked us to look at. How can we use technology to make sure that people have access to the services that they need? And so we have a lot of lessons that we've learned from COVID, where people were applying for benefits online, and we've been able to keep those in place. So you know that in Access HRA, you can now apply for benefits online. You can you can renew your City for HEPS vouchers online, and I think there's maybe 90% of the benefits that we have right now are able to still be being applied online. That makes such a difference as people are out looking for jobs, as you don't want to take your kids out of school, to make things more convenient. We also want to make sure that people know what they're eligible for. A lot of people leave a lot of money on the table because they're not exactly sure. So using technology in all of those different ways to make sure that people have access, to make it easier for people, is something that the mayor has asked us to think about and to partner with. And so those are some of the ways that we want to continue to do that as we're moving forward.
Yeah, a great question, Andre. You know, we like to say we got it for you. Now we have to get it to you. And not having access through better use of technology is really preventing people. Number one, we send back billions of dollars to Washington, D.C. We don't access all of our state resources. You know, it's just too darn hard for people to go get access. The bureaucracy, people say, listen, I'd rather do without than go through all this madness. So when you have over 90% of people accessing some of their resources that are now using technology and online, that's a step forward, but we want a huge step forward. That's what our One City card is all about. We want to get to the place where you should not have to figure out what benefits you are eligible for, like SCREE and DREE and SNAP and others. We should be notifying you based on your profile. We have all your information. So we should be reaching out to you saying, hey, we noticed that you are eligible for these items. Please come in or please reach out online, fill out this form, etc. We've been doing this around child care, where a lot of people now are accessing child care, but we want to get to the place where all of these benefits are sitting on the table, they're staying on the table. We need to get into the pockets of New Yorkers, because when you get more, you spend it more, and you're able to put that money back into our tax pool and back into our employment pool. So we're with you. I'm a big believer that we have to be easier and more user-friendly. We got to move out of the rotary phone age and move into the smartphone age of technology and giving people access to benefits. Great question.
Skipped over cordless phones, right? All right, so next, thank you very much, Andre. Next, we're going to go to Lavicki at the Department of Homeless Services with a question about the city's hiring process. Lavicki?
Good morning, everyone.
Morning.
Thank you for the time. My question is, what changes will you implement to improve the hiring process for city agencies to mitigate difficulties in filling vacancies?
Well, there are a few things that we can do, and one of them, which I'm extremely proud of, is we partnered with DC 37 and started to do hiring halls. We found that we were telling folks who were looking for jobs that we want you to come to us. Instead of going out to the communities, to the community center, to schools, NYCHA developments, we started doing these hiring halls, and thousands of people started showing up and participated in these hiring halls. And we knew we had to streamline the hiring practice. DCAS, Department of Citywide Administrative Services, undertook an HR transformation earlier this year to be more transparent and really allowed our city employees to see where they can change job careers in the system. They can move up, they can get promotions, but also for outside folks to know how to come in and be part of city service. I mean, a pension, health care. No, it's a great package working for the city. You know, sometimes we say, listen, we can do more, but trust me, when you look at city employment in comparison to private industry, it is real stable employment, and you are helping everyday New Yorkers. But we're with you. We want to further make it easier. It takes too long. There are too many forms, too many documents, and that is what we're trying to change. We think there should be one master document that you should fill out instead of each agency having their own different document. Matt Frazier, our Chief Technology Officer, he's looking at how do we further move to the next level of making it easier to do so. Great question, and that's something that I'm really focused on accomplishing.
Mayor, if anybody has friends, family that want to apply for jobs for the city, please go to jobs.nyc.gov. We have thousands of jobs, like the mayor said, available for you. All right, our next question was submitted anonymously. It is, what can be done about the SEAMS program that's being used by HRA and lacks many key functional features? That's SEAMS, S-E-A-M-S. It's the acronym. This is affecting the entire program, the way the workers can work, the processing of information, and clients constantly coming back and forth.
So this is a very technical question, so I will start it and just also give the mayor probably a heads up. I don't know if he knows this issue. So SEAMS stands for Self-Sufficiency Employment and Assessment Management Systems, and it is one of my pet peeves. It's a system that's supposed to help when folks have work requirements. We keeps us our track of case management and also timekeeping. So it's a technical system, and from the very beginning, it was supposed to kick off in June of 2023. There have been hiccups in the system. So it's been very frustrating to the people who are working on it and not really good for the people, the New Yorkers that we serve. So the team put in a stabilization plan where basically we were troubleshooting as things would come up on the system. And I think we've done a pretty good job of that. But what we're really doing now is we're going to go from the beginning of the system to the end and really look at all the performance issues and functionality and do a much better job of identifying those gaps and working to address these challenges. I think we're going to be working with new providers and a new vendor in order to help us to do that. But it definitely has been something that has been challenging and frustrating for everyone that's at HRA, but it's on our radar, and we really want to work to improve it.
And you know, we can easily just sit back and say, let's just keep doing things the way we've always done them. But when you try something new from feedback from employees and others, it doesn't always go as smooth as you want. You know, we've had some hiccups, but we're never going to give up. You know, I like that. You know, we had some hiccups, but we're never going to give up. And so work with us. If you guys have recommendation on the SEAMS program, how to make it better, you know, we want to get it there on all of these initiatives. You know, I think about some of the stuff we did with drones, how it didn't operate as well as we wanted in the first, and now look at operations of our drones. And so our goal is never be afraid to fail. That's the first act in learning. So we're going to continue to push forward. We're going to get the SEAMS right. Work with us. Let's be patient with each other. The goal is to make sure that it's operating the way you need it to operate, and we're going to look forward to doing that.
Great. Thank you. Next, we're going to go to Jacqueline at the Department of Health and Mental Hygiene with a question about substance abuse. Jacqueline?
Hi, good morning, Mayor Adams, Deputy Mayor Williams Isom, civil servants. So I live in Harlem, and every day I see lives destroyed by drugs and addiction. And I just want to know, what more can we do, one, to keep drugs from coming into the city, and two, the drugs are so much more toxic and dangerous. Are the programs we have even working to help people kick the habit?
I'm going to start, neighbor, I'm in Harlem too, and I was on 125th Street early last Saturday, and I have to tell you, Mayor Adams, it was I felt like I was walking among the Walking Dead. It was very strange and unsettling to see so many people who were clearly in such distress. So I think we, of course, as an administration, we have seen what has happened post-pandemic and the misery and the mental health issues and how that exacerbated people's substance misuse issues. And we want to connect people to treatment, full stop. We understand harm reduction. Some people may not agree with it, but we think that it is saving lives. We know that it is saving lives. But I had this conversation with Deputy Mayor Chauncey over public safety. We also don't want to give up our public spaces, right? When I was taking my little ones to school, I didn't want to have to step over somebody with a needle in their arm in order to take, my son in order to school. So I think we can do a better job. I was thinking about Marcus Garvey Park, where now, the park looks so much different than it did before when there used to be crack vials and all these things on it. But there's still a time sometimes in the evening where it's not the greatest place to be. I think we can do harm reduction. I think we can do treatment. We've gotten the money from the Attorney General for the opioid settlement money that has been coming down, and we've been using that with the Department of Health. We've been using it at health and hospitals. Even the medical examiner has really had some innovative programs to really look at what we can see about drug overdose deaths and what we can learn from it. So as you know, there's a lot of people that are focused on it, I think you're right. The potency of the drugs is changing. How addicted people can get is changed. But I think we'll continue to learn more. But I think those three things, harm reduction, treatment, but not saying that we have to give over our public spaces, is all of the things that this administration and the mayor really wants to focus on.
Yeah, and you know, I like to travel at night to see the city at night because it really exposes a lot. And on 125th Street and Park Avenue by the Metro North, going down to Lexington Avenue, 125th, where the bus takes folks over to Randall's Island, to the shelter, you know, 1, 2 a.m. in the morning. And the other day, I was driving down 126th Street and Park Avenue, where we have one of our harm reduction sites located. I think that DM Williams Isom is right. It's a combination of how do you do these harm reduction sites and not give up the public space in the process. And there's a real balance of, you know, number one, we have a very aggressive way of trying to stop the drugs from coming into our community. We have almost a 20% increase in manpower that's assigned to stopping some of these drugs from coming in. We're having a national problem with overdose. The fentanyl issue, fentanyl is a very dangerous drug, and you know many of from marijuana to other drugs are being laced with fentanyl. This is a real problem, and we need the help from the national government because it appears as though it's coming from China through South America up through Mexico from drug cartels and making their way to our streets. And so that's some of the initiatives that we're doing with our partners. Matter of fact, our Deputy Commissioner of Intel is headed down to the border to look at other border issues. But drugs coming to the country is one of those problems. And you know, those problems play out on the streets. And I think that the Department of Health and Mental Hygiene has taken a real creative approach to this, about this reduction, how to tackle this problem head on, and we need to continue to do so. You know, it's a real problem. And part of it is education. I may be dating myself, but I remember as a child looking at this movie called Not Me. That movie, and we need to replay movies like that. It just inspired me so much. A young man who said, I'll never be on drugs, and found himself eventually on drugs and overdosed on drugs. So we need education, enforcement, and creativity on how to address this real problem. You know what, sister? Because people are hurting. I'm telling you. The drug epidemic that we're seeing is really saying that we're seeing a level of pain in our country. People are self-medicating themselves with drugs, and we need to go after that pain in a very real way. That's what we're seeing. The overproliferation of pain that is a combination that we must put in place. And your agency, DOHMH, are committed workers. I cannot thank them enough because they're seeing that pain every day on so many levels. But we know it's a real problem, and we're going to give it everything we have to sort of stop it from coming into our city, and then give people the assistance they need as they deal with the stress of that life has just dropped on all of us. All of us are going through some stuff, folks. Trust me, you know, and we got to just, you know, really give each other the nurturement that we need.
And Mayor, I would just point out two things. On 125th Street, that's one of our locations for Community Link.
Yes.
So that's if you haven't heard about it, it's a multi-agency effort to bring in, you know, obviously health department, sanitation, police department, a bunch of different agencies to talk about all the different ways we can help improve a community. And so 125th Street is one of them. And so Jacqueline, if you have specific ideas on that, we'd love to hear that. And then also, you know, it's obviously not the same thing as, you know, some of the harder drugs that we were just talking about, but we have Operation Padlock to Protect, which is going after all the illegal smoke shops and unlicensed cannabis shops across the city. And so, you know, there's just been a proliferation of them. I think we are close to, if not over, 1,300 illegal shops that have been shut down at this point.
That's right.
And AG James really helped us in some of the lawsuits going after those opioids that were being sold.
right.
We were able to put that money back into Healthton Hospital, and we even helped Staten Island, which they did not have a Healthton Hospital. We were able to partner with her and get money into Staten Island to deal with some of these drugs. So it's a combination. It's a holistic approach, and we want to make sure our partners are with us to make sure it's done correctly.
Great. Thank you, Jacqueline. Next, we're going to go to Tiffany at the Human Resources Administration with a question about street cleaning. Tiffany?
Yes. Good morning. I want to say good morning to all of you guys, especially you, Mayor Adams. I voted for you. Just saying. I think you're a great mayor, personally. So I just wanted to start with my question. Um, okay, the question that I had was, will you get a team of street cleaners to keep the abandoned lots and the buildings clean of illegal dumping and trash?
Thanks so much. I remember there's some footage of me back when I think I was either a state senator or borough president, probably state senator. Down the block from me, we had an abandoned piece of property, and the garbage was piled up, rodents was everywhere. And when we called DSNY, they said, "Well, it's not. It's in the street line, so we can't clean it up." And I was like, "What? What are you talking about?" It was abandoned. And so part of our initiative under the Commissioner Tisch from the Department of Sanitation was that we had to go into these no-man zones, and we had to go into our highways where, just litter, and just a combined effect. And we've done just that. We're not what we want to be. And Tiffany, do you know, my team would tell you, I ride around at night and look for encampments, look for dump location. I take pictures and I send them to them and say, "Listen, we got to clean this up."
You know what? If I can,
Yes.
if I can, right now, listen, I was born and raised in Bed-Stuy. But right now I moved to East New York, right? I can upload or tell you some blocks right now that there's just there is just lots that people just come and they just dump their trash. And there's one now, they're starting to build an encampment in East New York down there somewhere on it's around when you coming down Pennsylvania around Pickin and up there Glenmore, um, Warwick, all around that area. There are just lots right there around the corner from me. There's a building. People just come and it's disgusting. No one is doing anything about it. And I just want to know, with all of these people that are coming in, you know, are they going to, be having some of them, if they have to do anything, I'm talking about as far as employment or getting themselves employment, why don't, or take the people from the prisons, low level crimes and have them clean that up as a punishment.
And I understand what you're saying, but first, I want to zero in on. We realized that illegal dumping was a problem, so we installed about 300 cameras at these normal dumping locations. And when we catch people, they get a summons, and those summonses are $4,000. Start at $4,000. So I'm gonna have a team go out and look at what you were talking about. Where you're saying that you're seeing the encampments, because we really changed the game on encampments in the city. We closed thousands of these encampments, giving people services because there's no dignity in living on the street. I say that over and over again, but that creative way of having either migrants and asylum seekers and others who could be part of our clean task force, that's a creative way of making sure people become gainfully employed and also find ways to give back to their community in a real way. But we've been a big believer under the Deputy Mayor Williams Isom's portfolio. We've been a big believer migrants and asylum seekers should have the authorization to work. Right now, we have been able to help a great deal of people get that authorization and fill out their documentation, but we think everyone should have the ability to work, and that feeds into what you're talking about now. But we're going to look at that location you're talking about, but we have really zeroed in on a clean city. You know, last fiscal year, we cleaned 3,000 miles of highways, 19,000 what we call forgotten city sites that went unclean, and over 20,000 graffiti removals. We know cleanliness is next to godliness.
Thank you. Thank you, Tiffany. Our next question was submitted anonymously. It is there a way for me to find a real affordable home? After 27 years, my salary does not match the cost of living in this beautiful city. Sad.
Yeah, no, real story. And I think DM Williams Ison was talking about her children, and that's how I feel about Jordan. You know, we send them away to college. Hopefully, they come back, and then they can find a place to live and start a family. But it's just too darn high. You know, when you have 50% of the people paying more than 30% of their income to rent, it's just challenging. And so, what we have to do a couple of things. Number one, we have an inventory problem. We have a 1.4% vacancy rate. So supply and demand always states if the supply is low and the demand is high, the cost is going to be high. That's what the city of Yes is about. We're negotiating with the city council more. We have to build more. 59 community boards we have in the city. The city is divided by community boards. Out of those 59 community boards, 10 of them have built more affordable housing than the other 49 combined. Too many places in the city are not doing their job of allowing buildings to take place, and so we got to get the city of Yes passed. That's so important. Now, we're doing our part. $26 billion we are placing in public housing and affordable housing over the next decade. But with this city of Yes, it's going to allow us to build 108,000 units of housing in a 15-year period. We got great victories in Albany about raising the FAR, being able to build higher, not being too technical, and converting office space into housing. So we're going to do our part, but we really need everyone to lean into our city council members and say, let's pass the city of Yes. And what we did under this administration for the first time, we did not ignore NYCHA. We made public housing part of our housing plan, and that's what Deputy Mayor Maria Torres Springer pushed for. We did projects that were dying, 2,400 units out in Shea Stadium. Those of us who are familiar with Queens, those of abandoned locations for years remain there. We're developing that area, and we're developing other parts of the city. But we agree, it's too expensive. One way to bring it down is to build more. We have an inventory problem.
So just, Mayor, on the city of Yes that you were talking about, if folks don't know, it's building a little more housing in every neighborhood across the city. So it's not just, bombarding one neighborhood or the other. It would build 108,000 units over 15 years and help bring cost of rent down across the entire city. So this is a huge thing. Next week, it's the subcommittee vote in the city council. And then in December, we're going to have a full vote by the city council. So you should learn more about City of Yes online.
Yeah, and we have really leaned into housing. Last year, we financed more new affordable homes in our city's history. We moved more people out of homeless shelter into permanent housing in our city history. You look at all of these numbers, and that's why we do these town halls, because you need to know what you have done in this administration by working together. We want you to stay in the city. You should not have to leave this city because of affordability issue.
Great. So our next question was submitted by Tara from the Administration for Children's Services, who unfortunately was not able to join us this morning. So Tara's question is, this is your favorite question, Mayor. What is the city of New York doing about rodents?
Oh man, everybody know I hate rats. Now what I want to thank Tara for a question, but also want to thank ACS. The job of having the right balance of not removing a child from a home prematurely, but removing them when the indicators are there. You get it wrong one time, that judgment call one time, the weight of the city is on you. And I know how hard the job is. And I just want to thank my ACS workers and what they are doing every day. People don't see all the successes that you have, but I do. And I want to thank Tara and your team over there. Rats are a real problem in this city. You know, they say for every one human being, I think there are like thousands of rats. And so we have to figure out how to control them. And one of the things that we did that no one thought was possible, many people tried, but we accomplished that, and that is containerizing our garbage. Hats off to Commissioner Tisch over at DSNY. Yesterday, we announced that 70% of our garbage now is going to be in containers. It was this level was 1 to 9 units. People thought it was going to take us 5 years. We're doing it within less than 3 years, a real accomplishment to say the least. So that means 14 billion pounds of trash that New York City produces each year will go into bins and containers. And so we're really excited about that. But we also put in place a rat czar. She created the Rat Pack, where everyday New Yorkers can go through the Rat Academy to learn about how to rat-proof their communities, and particularly around our rat mitigation zones, so that we're seeing a decrease in complaint in our rat mitigation zones and citywide rat complaints. And she's using educations on what needs to be done and how we could do it together. And this is what we believe that everyday New Yorkers can do to really deal with the rodent issue. Plastic bags, they are the enemy. And we need to get plastic bags off our streets. They create the all-you-can-eat buffets that rats enjoy. And that is why we believe one of the top ways we could do it is to have our garbage placed in containers.
And Mayor, since you were talking about that yesterday, it went into effect for small 1 to 9 units. If you're a small landlord or you live in a building that just has 1 to 9 units, encourage your landlord. Bins.nyc, you can get a low-cost bin that has a lid, that has a latch, and make sure it's there. You know, try to reduce the rat population.
I got my bins last week. The only thing that I'm trying to figure out is how to secure them so somebody doesn't walk off with my bins.
Yeah, I've seen a lot of people get a small chain and just to their
That's
gate.
what I need to do.
And that way, yeah. You don't have it. All right. So next, we're gonna have another question from ACS. Michael from ACS has a question about juvenile justice. Michael.
Good afternoon from my location. Good morning to you.
Michael.
Good morning, Deputy Mayor. Good morning to my co-public servants. I just want to say before I proceed my question, I am cutting my vacation short just to partake in this forum. I'm in Buenos Aires, Argentina. I'm a youth development specialist at ACS. I've been working in that role for 5.5 years. And my question to you, Mayor, is what is being done by your administration to address the overcrowding of youths in both Crossroads Juvenile Center in Brooklyn and also in Horizon, the juvenile center there? The capacity for both buildings is 120. The last census we had, when I last worked there last Tuesday, at Crossroads was 137. My unit, it's 16 capacity. At night, we have up to 20. And this is the case with all the 10 units at Crossroads and also in Horizon. So in general, what your administration has been doing to reduce the overcrowding, and I presume this is due to a rise in teenage crime, but is there any criteria that can be implemented to reduce those who are sent to detention, for instance?
So, Michael, I'm going to start. Michael, I'm going to start answering, and I'm also reminding the mayor that really early in your administration, you went and you visited the staff there because the staff were in a bad situation. They were trying to do the best that they could and to really made promises about improving the spaces. So you of all people know, because you're there, that it's been really difficult, and the staff has been doing such a great job. Like, actually, the assaults are down, and the safety factors for those young children, when you consider the stress of that moment, has really been improved. So we're trying to do a lot of things, and one of the things that we have to think about is how do we not get work on prevention in the first place so that young people are not ending up in these places. We know that there's a lot of older adults, older young people who are there, so we're trying to build an annex so that we can separate that and have separate mental health programs, the good programs that we need, so that we can really focus on the young people at the original spot. I think when we think about what this administration has done, and it's hard for us to think upstream, but summer jobs, after school, programming, all of those things is what helps keeps young people on the path to being engaged so that they don't end up arrested in these particular places. And I think the mayor, when he came on board, was like, we need to focus on those upstream strategies, not just trying to deal with them once they get into detention. But I think that we are also working with agencies, prosecutors, judges, and others to find safe alternatives for youth facing detention, whether that's therapy, mediation, and electronic monitoring has been something that we've been thinking about before, earlier on in this administration, that we really want to pursue. As I said, we see that the violence is going down, and we also see that high school graduation is going up. Again, on the one hand, I'm happy about that, but on the other hand, I wish that the young people didn't have to come to detention to go to high school.
Right.
But I think we can work on both of those things together. Commissioner Danhauser has been very focused on this, and weekly we have a meeting about secure detention and about making sure that we can build this annex so that we give additional space.
Yeah, no, and again, as DM Williams Isom stated, again, your feedback is crucial. Because you're there, you're on the ground. That's why I went out to visit the location so I could hear from the staff that are there. And, there was a whole big change in how young people were handled in the criminal justice system with raise the age. Some of the young people there, are a bit older. Some of the crimes are more serious. So it's a full frontal approach that we need to do. And we're going to need the help from our state partners as well as our city lawmakers. Prevention is the key. We don't want to wait until they get there. And that's why we had more summer youth employments. We've increased from 75,000 to 100,000. Our Summer Rising program, getting over 100,000 young people into school. The Team Space initiative. Some of these young people are dealing with just mental health issues, and they need to support and wraparound services. And like we were talking about with our foster care children, 600 to 700 were aging out every year without any real support. That's why we are paying the college tuition, giving a stipend, giving them life coaches, because we went upstream to prevent people from falling in the river and pulling them out downstream. If we're pulling them out from Safe Horizon, we failed upstream. We want to have an upstream approach.
That's right.
As well as a downstream assistance that's needed. But, really thank you for your question. Thank you for cutting your vacation short to, be on and ask that question. And the work that you're doing, I think, is commendable.
Thank you, Michael. Our next question was submitted anonymously. It is, as a senior citizen, I feel it's become very dangerous to walk the streets of Manhattan due to the speeding electronic bicycles. What about licensing for these vehicles and severe penalties for violations?
Big. We hear every town hall we attend, we hear if it's the senior town hall, if it's the regular town hall, people talk about the mopeds and the real transformation of our streets. It really happened after COVID. People started ordering out more, and some people did not want to ride on the subway system, so they have been using these micro mobilities devices to move around. But we have been zero focus on it. We have more that we want to do, but I want you to know we have not ignored that. Number one, Assemblywoman Jennifer Rajkumar is introducing legislation that is going to do just that, to license these vehicles, make sure they have insurance, because when they strike you, if they don't have insurance, you're left to foot the bill. So we believe licensing is crucial, but also we've launched the Get Smart Before You Start campaign, because many people are not aware that, listen, you can't ride these scooters on the sidewalk, down one-way streets, speed and run red lights. So we want to educate people on how to ride, but we also are very much part of enforcement You may not realize it. We took over 52,000 illegal mopeds and scooters off our streets and destroyed a large number of them so they could not be recycled in our streets. So we want to stop at the point of sale to stop these illegal devices to be on our streets, ATVs and others. We're with you. We know they become a hazard, and we're doing enforcement, education, and legislation to get it under control.
Great. Next, we're going to go to Wahid at the Human Resource Administration with a question about paper usage and sustainability. Wahid?
Good morning.
Good morning.
Can you hear me?
Yes.
I'm sorry, I'm not prepared properly because I had field work today. However, I'm participating. It's my pleasure and I'm honored. Thank you, Mr. Mayor, for introducing City Hiring Hall because I got my job from that kind of hiring hall. And I'm grateful for that. And I have no question. Actually, I have an idea. I am working for New York City. Basically, I'm working for HASA. We are working the clients of AIDS and HIV patients. And what I observed, we are using a lot of documents. Every day we are printing hundreds, thousands of papers. If I'm not wrong, US government is working on paperless or green operations, and they are promoting this concept all over the world. But what we are doing, we are using paper like traditional people. We are printing, we are signing, we are scanning and indexing. We are storing documents in electric form, but what we are practicing, we are practicing the traditional, very laggard form. For example, I can give you lots of examples, but I can share you an example. If we want to propose any changes or any request, if we forward to another department, what we do? We type in a form that's called W488H, case of actions form. And we print it out. We attach three pages of WMSS prints and other supporting documents. Then we send it to another department. What they do, the same thing, we are scanning and indexing, and we are inserting notes in our website, and in the system we are using software. Then why we are doing these printing jobs? And in person, we are dropping it to others' basket. They are taking this, they are seeing this, and they are verifying these informations with the system, and they are throwing out. I mean, they are dropping it in a shredding box. So this is a very little.
Mr. Wahid, we want to make sure we get to your colleagues. It sounds like to me you're saying that we can better utilize technology, that we don't use paper over and over again.
Right.
And we agree with you.
Yes.
And right now, over 90% of people apply for benefits online, and we want to continue to expand that. We need to move to a paperless society as much as possible, and technology is allowing us to do that. A lot of forms you could get on your devices, you could fill them out on your devices, and so there's a real movement towards trying to alleviate as much paper and forms as possible. So we hear you loud and clear. and we support that idea, and we're going to do as much as possible to move towards a paperless society.
And actually, like 90% of people apply for benefits online
Yes.
instead of through paper, and so that's why, like, you utilizing technology, even my city that you're trying to, for not even for internal but external folks, it
Makes
shows
a
like a
difference.
real, movement towards
Good for the
going
environment.
paperless.
Yep. But so thanks so much for that question.
Great.
An idea.
So we have time for one more question for closing remarks. So our last question was submitted anonymously, but I think a lot of people are wondering about this. Will you allow for more flexibility for work for home arrangements and other strategies to retain young talent in the agencies compared to other jobs that are attractive in the market?
Yeah, no, so true. You know, I was just answering that question yesterday at our off topics, that you have to now become attractive to retain and to bring in talent. You know, I know you said that more young people could be attracted, but there's a whole lot of old folks also that want to stay home as much as possible. Trust me. And so we are, the pilot is expiring, I think is in May. So we're going to do an analysis. We got a lot of feedback. It was great sitting down with Henry Garrido from DC 37, the head of DC 37. We rolled it out in agencies across the city. Now we're going to do an analysis and determine what modifications, what expansion. You know, of course, some jobs you can't do remotely. If you're a police officer, firefighter, for the most part. But there are a number of jobs that we believe COVID showed us that they could be done in a remote way. And we're going to look at it, make that evolution, and continue to show that working for the city is an attractive form of employment, and it is rewarding because you give back, and no one gives back more than this portfolio under Deputy Mayor Williams Isom. And so listen, we want to thank all of you for joining. Each one of your questions will be answered. Although we were unable to get to everyone, we will be answering. You'll get a response from all of us. But I want to say thank you for bringing the city to where it is. We've come a long way from January 1st, 2022, and because of your commitment and dedication, this city is on the right road to the recovery that it deserves. DM, you want to?
I do. I want you to have the last word so you can react to what I'm going to say a little bit. I want to say that you are the healers, and sometimes the healers don't take care of themselves. The mayor was talking about the pain that we see in the city, in this country, in our families, and he always says we're all going through something. And regardless of whether we're going through something, we certainly feel it and we are affected by it. My last boss always used to say that despair is contagious. And if you're around people all the time who are really stressed out and things feel heavy, that's contagious. But hope is also contagious. Right. And you all bring hope to people who are at some of the most difficult times in their lives. And so I need you to take care of yourselves. Right. We joked about Michael being on vacation and sort of taking away time from vacation. But taking time for yourself, to me, in these times is a revolutionary act. I recently ran the marathon. I didn't run the marathon so that I could beat Fabian. I ran it because it helped with my stress, because it helped me get to be able to silence sometimes the back and forth that's in my brain. It helped my body become stronger and for me to understand what I could do at 60. Helped me, my husband, not get on my nerves so much. What are the things that you need to do for yourself, for your family, for yourself, so that you can then show up for this really incredible work that you've done? You're doing a great job, but I don't want you to do it and burn yourself out. I want you to know that we're here and we see that you are the healers in this city, and that we want you to be able to bring that hope. You can only do that if you take care of yourself. So I want to leave you with that today and want to thank you from the bottom of my heart for all that you do for some of the most vulnerable people here in New York City.
Well said.
Thank you, Mayor. Thank you, Deputy Mayor Williams Isom. Thank you to everyone for joining us today, and thank you for those who submitted questions. We'll make sure to get back to the 200 plus folks who submitted questions. Thank you again.